25 respiratory nursing practice questions. 1. A 37-year-old female patient has been newly diagnosed with asthma and is admitted at the respiratory ward. She is prescribed with albuterol, Prevent-Il. It is important to inform the patient that this drug commonly causes A. Fatigue, B. Nasal congestion, C. Shakiness, D. Low platelet count. Answer: C. Shakiness. Rationale: shakiness is the most common side effect of albuterol, Prevent-Il. Other side effects of albuterol include hypokalemia, dizziness, nausea, palpitations, and muscle cramping. 2. A 22-year-old male patient started to have symptoms of acute rhinitis. The nurse should recognize that one of the symptoms of this medical condition is nasal drainage. In which color? A. Clear, B. Yellow, C. Green, D. Gray. Answer: A. Clear. Rationale: acute rhinitis involves excessive nasal drainage that is clear in color. If it is yellowish or greenish, then infection of the sinuses or other parts of the respiratory system can be suspected. 3. A respiratory patient develops respiratory distress syndrome and is rapidly deteriorating. The patient is now intubated and is started on mechanical ventilation. While doing nursing rounds, the mechanical ventilator's high-pressure alarm starts. All of the conditions can cause this alarm, except A. A kink on the ventilator tubing, B. Disconnection of the ventilator tube, C. Mucus plug, D. Water leaking into the tube. Answer: B. Disconnection of the ventilator tube. Rationale: a high-pressure alarm in a mechanical ventilator could mean that there is a presence of mucus plug, water in the tube, or a kink in the tubing. It can also be triggered by pulmonary embolus or bronchospasm, as well as biting or coughing on the endotracheal tube. A disconnected ventilator tubing can trigger a low-pressure alarm. 4. A patient came to the emergency unit with shortness of breath. Upon auscultation, the nurse begins to suspect right-sided pneumothorax due to which of the following findings? A. Absence of breath sounds in the right thorax, B. Bilateral crackles, C. Wheezing in the right thorax, D. Pleural friction rub in the right thorax. Answer: A. Absence of breath sounds in the right thorax. Rationale: there is no air exchange occurring in the affected lung when there is pneumothorax, due to damaged and deflated alveoli. This makes the breath sounds absent in the affected lung. 5. A 56-year-old female patient is admitted due to exacerbation of COPD or chronic obstructive pulmonary disease. The nurse prioritizes the nursing diagnoses based on their urgency and importance. Which of the following nursing diagnoses should be prioritized? A. Anxiety, B. Risk for infection, C. Impaired gas exchange, D. Activity intolerance. Answer: C. Impaired gas exchange. Rationale: all the options are crucial for the care of a patient with COPD and exacerbation. But the most important nursing diagnosis for this patient is impaired gas exchange, related to airflow obstruction, as this includes deteriorating oxygen levels in the lungs, which is considered a medical emergency compared to the other 3 nursing diagnoses. 6. A 66-year-old male patient has a chest tube drainage following left lung pneumonectomy. Which of the following nursing actions is included in the care of a chest tube drain? A. Milk the chest tube every 2 to 3 hours. B. Encourage the patient to do deep breathing and coughing exercises. C. Clamp the chest tube every 4 hours. D. Monitor the water seal chamber for any fluctuations. Answer: B. Encourage the patient to do deep breathing and coughing exercises. Rationale: a one-sided pneumonectomy puts the unaffected lung at high risk for pneumonia. To prevent this, the patient needs to be encouraged to perform deep breathing and coughing exercises. Since the left lung has been removed, there will be no fluctuations in the water seal chamber. Clamping every 4 hours is not required, and chest tube milking is only done when there is an obstruction in the drainage flow inside the tube. Note: most facilities do not recommend milking the chest tube. 7. A 69-year-old female patient is diagnosed with adult respiratory distress syndrome, ARDS. Which of the following conditions is associated with ARDS? A. Pulmonary congestion related to heart failure, B. Renal failure, C. Non-cardiogenic pulmonary edema, D. Respiratory alkalosis. Answer: C. Non-cardiogenic pulmonary edema. Rationale. In non-cardiogenic pulmonary edema, there is an increased permeability of the pulmonary capillaries that is not caused by any heart conditions. This problem eventually causes ARDS. Respiratory alkalosis, heart failure, and renal failure do not lead to ARDS. 8. A 55-year-old patient is diagnosed with pneumothorax and is inserted a chest tube for drainage. When doing nursing rounds, the nurse notices that there is gentle bubbling in the suction control chamber. Which nursing action is appropriate? A. Clamp the chest tube and inform the doctor. B. Check for air leak. C. Increase the pressure of suctioning. D. No intervention required as gentle bubbling is expected. Answer. D. No intervention required as gentle bubbling is expected. Rationale. Gentle bubbling in the suction control chamber is an expected finding in a patient with pneumothorax. The bubbling should not be intermittent or vigorous. Rather, it needs to be continuous and gentle. Absence of bubbling may indicate either re-expansion of the affected lung or a blockage in the tubing. 9. A patient's endotracheal tube was removed an hour ago. The nurse monitors the patient and immediately alerts the physician if he or she has assessed that the patient develops A. 1 episode of pink-tinged sputum. B. Respiratory rate of 27 cycles per minute. C. O2 sat of 95% on room air. D. Stridor upon auscultation. Answer. D. Stridor upon auscultation. Rationale. Stridor is a coarse, high-pitched sound that can be heard when auscultating over the trachea. The presence of stridor means that there is swelling in the airway, which puts the patient at high risk of obstruction of the airway and difficulty of breathing. Thus, the nurse needs to immediately report the finding to the doctor for immediate medical attention. 10. A public health nurse conducts a community health teaching on tuberculosis. Which of the following should the nurse include in the teaches the first sign of this respiratory condition? A. Bloody sputum and productive cough. B. Chest pain. C. Shortness of breath. D. Mucoid sputum and productive cough. Answer. D. Mucoid sputum and productive cough. Rationale. The first sign of tuberculosis is usually a productive cough accompanied by mucoid sputum. The other signs such as shortness of breath, bloody sputum, and chest pain can be considered as late signs of tuberculosis, which may mean extensive disease and lung cavitation. 11. A 50-year-old male patient is diagnosed with pulmonary edema. All of the following can become complications of this medical condition, except A. Abdominal edema. B. Pleural effusion. C. Ulcerative colitis. D. Liver failure. Answer. C. Ulcerative colitis. Rationale. If left untreated, pulmonary edema may cause edema of the abdominal cavity and lower extremities because pulmonary edema can further increase the pulmonary arterial pressure. The increased pressure in the pulmonary circulation may lead to the accumulation of fluid in the pleural cavity which surrounds the lungs, causing pleural effusion. There can also be increased pressure in the hepatic portal system, causing the liver to be congested and swollen, thereby unable to detoxify the blood as normal. 12. A 46-year-old hypertensive female patient was admitted 12 hours ago with severe pneumonia and has now developed pulmonary congestion. The nurse should expect the doctor to prescribe the following medications for this patient, except A. Antihypertensives, such as ramipril. B. Antibiotics, such as nitrofurantoin. C. Diuretics, such as furosemide. D. Anti-cholesterol drugs, such as simvastatin. Answer, B. Antibiotics, such as nitrofurantoin. Rationale. The pneumonia is the likely cause of pulmonary congestion, so the doctor will prescribe an antibiotic drug. However, nitrofurantoin is inappropriate for this patient as this drug may actually worsen the pulmonary edema. To decrease the fluid that has accumulated in the heart and lungs, diuretics such as furosemide, Lasix, are usually administered. Hypertension may eventually lead to pulmonary edema, thus, antihypertensives may be required. For cardiogenic pulmonary edema, anti-cholesterol drugs might be prescribed to reduce the LDL or bad cholesterol that clog up the cardiac arteries. 13. A male COPD patient calls for the nurse and verbalizes that he is having difficulty of breathing and is starting to get anxious. Then nurse finds the patient in a slouched position on the bed. So the nurse elevates the head of the bed. What is the primary rationale for this nursing action? A. To promote expansion of the lungs. B. To increase the patient's comfort. C. To reduce the patient's anxiety. D. To facilitate pain relief of back muscles. Answer. A. To promote expansion of the lungs. Rationale. Head elevation helps improve the expansion of the lungs, enabling the patient to breathe more effectively. When the patient breathes better, he will feel less anxious and more comfortable. 14. A 45-year-old female patient with COPD has productive cough with thick phlegm. All of the following nursing interventions can facilitate the clearance of thick airway secretions for this patient, except A. Chest physiotherapy. B. Saline nebulization. C. Oxygen therapy. D. Suctioning. Answer. C. Oxygen therapy. Rationale. Chest physiotherapy involves using vibration and percussion techniques on the thorax to help dislodge thick airway mucus and help the patient expectorate it. Saline nebulization helps break down thick airway secretions. Suctioning helps to manually remove the secretions. Oxygen therapy aims to increase oxygen levels, not to remove secretions. 15. A senior staff nurse is mentoring a newly qualified nurse in the respiratory unit. The senior nurse tells the new staff member that COPD can be further distinguished into the following respiratory conditions, except A. Refractory asthma. B. Pneumonia. C. Emphysema. D. Chronic bronchitis. Answer. B. Pneumonia. Rationale. Chronic obstructive pulmonary disease, COPD, is an umbrella term that is divided into three specific respiratory problems, which include emphysema, chronic bronchitis, and refractory asthma. Pneumonia is a bacterial respiratory infection that is not classified as COPD. However, people with COPD are highly susceptible to infections such as pneumonia. 16. A community health nurse is conducting a health teaching on chronic obstructive pulmonary disease, COPD. The nurse should say that all of the following are causes of COPD, except A. History of lung cancer. B. Exposure to fumes. C. Tobacco smoking. D. Alpha-1 antitrypsin deficiency. Answer. A. History of lung cancer. Rationale. Tobacco smoking is the #1 cause of COPD. Exposure to chemical fumes and vapors may also cause COPD. Alpha-1 antitrypsin deficiency is a genetic disorder that is found as the cause of a small number of COPD cases. Lung cancer is not a direct cause of COPD, but it can be a complication of it. 17. A 42-year-old male patient is newly diagnosed with COPD. He is a long-term smoker. All of the following treatments may be incorporated in the care of this patient, except A. Smoking cessation. B. Oxygen therapy. C. Diet modification. D. Pulmonary rehabilitation. Answer. C. Diet modification. Rationale. Smoking cessation is an integral part of the nursing care plan for the patient, as this is the most likely cause of COPD. Oxygen therapy may be required, depending on his oxygen levels. Pulmonary rehabilitation is helpful in achieving the optimal lung capacity for this patient. Diet modification may not be a priority as it is unrelated to COPD. 18. A 54-year-old patient has coronary artery disease, CAD, and develops pulmonary edema. Which of the following medications can decrease the fluid accumulation in this patient's heart and lungs? A. Ramipril. B. Furosemide. C. Meropenem. D. Simvastatin. Answer. B. Furosemide. Rationale. To decrease the fluid that has accumulated in the heart and lungs, diuretics such as furosemide, Lasix, are usually administered. 19. A post-thoracotomy patient is given epidural analgesia for pain relief. Which of the following findings should the nurse report to the doctor as it may indicate a complication of epidural analgesia for this patient? Answer. A. Respiratory rate of 10 breaths per minute. Rationale. A respiratory rate of 10 breaths per minute may indicate the start of respiratory depression, which is a serious complication of using epidural analgesia and requires immediate medical attention. 20. The nurse administers codeine to relieve the persistent intractable cough in a male client. The nurse informs the patient that she will reassess the patient's response to the medication. A. Within 4 hours. B. Within an hour. C. After 30 minutes. D. After 2 hours. Answer. C. After 30 minutes. Rationale: codeine is used to help with intractable cough. The patient must be reassessed after at least 30 minutes of administration of codeine as the onset of drug action occurs at this time. The peak concentration of codeine happens an hour after administration. 21. Pneumonia is a respiratory infection that occurs with which of the following pathological mechanisms in the lung? A. Inflammation. B. Effusion. C. Atelectasis. D. Bronchiectasis. Answer. A. Inflammation. Rationale: there are different types of pneumonia, but all of them have the common feature of inflammation in the lung parenchyma for the pneumonia to develop. The inflammation is caused by an invading organism, such as viruses or bacteria. 22. An 11-year-old male patient is admitted to the emergency unit having a respiratory rate of 32 breaths per minute, afebrile, difficulty of breathing, and non-productive cough. There is no family history of smoking. Which of the following is the likely respiratory condition of this patient? A. Emphysema. B. COPD. C. Acute asthma. D. Pneumonia. Answer. C. Acute asthma. Rationale: the patient is likely to have acute asthma, as he has tachypnea, shortness of breath and a non-productive cough. He is unlikely to have pneumonia if there is no productive cough and fever. The patient has no family history of smoking, and is too young to have COPD and emphysema. 23. The nurse conducts a physical assessment of a patient with shortness of breath and tachypnea. Upon chest auscultation, which of the following findings may indicate asthma? A. Normal breath sounds. B. Wheezes. C. Bilateral crackles. D. Stridor. Answer. B. Wheezes. Rationale: wheezes during inspiration and expiration are common signs of asthma. Crackles can be heard in patients with pneumonia or bronchitis, while stridor may indicate swelling of the trachea and larynx. 24. A patient with asthma calls for the nurse and shows signs of difficulty of breathing. Upon further assessment, the patient seems to have a decreased expiratory volume. Which of the following drugs can help treat this acute problem? A. Oral steroids. B. Inhaled steroids. C. Beta-adrenergic blockers. D. Bronchodilators. 25. A 60-year-old male patient is admitted with long-term productive cough, thick sputum, cyanotic nail beds, and swelling of the limbs. He mentions that he has been smoking since he was 15 years old, and usually smokes a pack of cigarettes per day. Which of the following medical conditions is he likely to have? A. Emphysema. B. Chronic bronchitis. C. Asthma. D. Acute respiratory distress syndrome. Answer. B. Chronic bronchitis. Rationale: cyanosis of the nail beds, peripheral edema, chronic productive cough, and an extensive history of smoking can all support the diagnosis of chronic bronchitis. Peripheral edema and long-term cough are not usually associated with emphysema, asthma, or ARDS. This concludes 25.
Question 1. A patient with a history of COPD has an oxygen saturation of 88%. Which intervention should the nurse prioritize? A. Increase the patient's oxygen flow rate. B. Encourage the patient to use a pursed lip breathing technique. C. Administer a bronchodilator nebulizer treatment. D. Reposition the patient in a high Fowler's position. Answer. B. Encourage the patient to use a pursed lip breathing technique. Rationale: pursed lip breathing helps to improve oxygenation in COPD patients by promoting optimal lung expansion. Question 2. A patient has been diagnosed with pleural effusion. Which symptom is most characteristic of this condition? A. Wheezing. B. Hemoptysis. C. Dyspnea. D. Cyanosis. Answer: C. Dyspnea. Rationale: pleural effusion refers to fluid buildup in the pleural space. This can cause difficulty in breathing or dyspnea. Question 3. Which instruction is important for a patient receiving a TB skin test? A. Avoid scratching the test site. B. Return in 48 to 72 hours for reading. C. Keep the site covered with a bandage. D. Wash the site with soap and water. Answer: B. Return in 48 to 72 hours for reading. Rationale: the results of a TB skin test should be read within 48 to 72 hours, but preferably around 48 hours after administration. Question 4. Which of the following is a late sign of hypoxia? A. Tachycardia. B. Cyanosis. C. Restlessness. D. Dyspnea. Answer: B. Cyanosis. Rationale: cyanosis is a late sign of hypoxia. Early signs include restlessness, tachycardia, and dyspnea. Question 5. A patient is scheduled for a thoracentesis. In which position should the nurse place the patient? A. Lying flat on the back. B. Sitting upright and leaning forward. C. In Trendelenburg position. D. In left lateral decubitus position. Answer: B. Sitting upright and leaning forward. Rationale: this position allows for the best access to the pleural space and minimizes risk of injury to lung tissue. Question 6. For which patient would the nurse anticipate administering a bronchodilator? A. A patient with a pneumothorax. B. A patient with a pulmonary embolism. C. A patient with asthma. D. A patient with pleural effusion. Answer: C. A patient with asthma. Rationale: bronchodilators are primarily used for conditions like asthma where there is bronchoconstriction. Question 7. A nurse assesses the respiratory rate of an adult patient and counts 28 breaths per minute. The nurse should interpret this as: A. Normal. B. Bradypnea. C. Tachypnea. D. Hyperpnea. Answer: C. Tachypnea. Rationale: a respiratory rate above 20 breaths per minute in adults is considered tachypnea. Question 8. Which condition can result from a long-term deficiency in alpha-1 antitrypsin? A. Asthma. B. Bronchitis. C. Emphysema. D. Lung cancer. Answer: C. Emphysema. Rationale: alpha-1 antitrypsin deficiency can lead to emphysema, as this protein protects the lungs from neutrophil elastase. Question 9. A nurse is teaching a patient with chronic bronchitis about the importance of fluid intake. What rationale should the nurse include in the teaching? A. Increased fluids can help thin secretions for easier expectoration. B. Fluids will help decrease your cough reflex. C. Drinking more fluids will reduce your risk of pneumonia. D. Fluids will prevent dehydration from frequent coughing. Answer: A. Increased fluids can help thin secretions for easier expectoration. Rationale: increased fluid intake can help to thin mucus in the bronchi, making it easier to cough up. Question 10. A nurse is teaching a patient about the proper use of a metered dose inhaler. Which statement by the patient indicates a need for further teaching? A. I will shake the inhaler before use. B. I'll exhale fully before using the inhaler. C. I will hold my breath for a few seconds after inhaling the medication. D. I'll breathe in quickly when activating the inhaler. Answer: D. I'll breathe in quickly when activating the inhaler. Rationale: the patient should breathe in slowly and deeply when activating the inhaler to ensure the medication reaches deep into the lungs. Question 11. Which finding would be of most concern to a nurse assessing a patient 24 hours after a lobectomy? A. Slight bloody drainage from the chest tube. B. A decrease in breath sounds on the affected side. C. A temperature of 99.5 degrees Fahrenheit 37.5 degrees Celsius. D. Pain at the incision site rated 6 on a scale of 10. Answer: B. A decrease in breath sounds on the affected side. Rationale: a decrease in breath sounds might indicate a complication such as atelectasis, pleural effusion, or pneumothorax. Question 12. A nurse is providing discharge teaching for a patient who had a spontaneous pneumothorax. Which statement by the patient indicates understanding? A. I should avoid flying for at least a month. B. I can resume smoking in small amounts after a week. C. I should expect to feel severe pain for several days. D. It's safe for me to start weightlifting right away. Answer: A. I should avoid flying for at least a month. Rationale: changes in atmospheric pressure during flight can exacerbate or cause recurrence of a pneumothorax. Question 13. Which action is most crucial for a nurse to take when suctioning a tracheostomy? A. Suction for a maximum of 20 seconds. B. Pre-oxygenate the patient with 100% oxygen. C. Suction while inserting and removing the catheter. D. Apply suction only when withdrawing the catheter. Answer: D. Apply suction only when withdrawing the catheter. Rationale: suction should be applied only when withdrawing the catheter to prevent trauma to the mucosal lining. Question 14. A patient with tuberculosis asks the nurse how long they need to be on medication. The nurse should reply: A. For a week. B. For a month. C. For 6 months to a year. D. For the rest of your life. Answer: C. For 6 months to a year. Rationale: the standard treatment for active tuberculosis usually lasts for 6 to 9 months, depending on the specific medications and the patient's response to them. Question 15. A nurse should recognize which of the following as a risk factor for lung cancer? A. A diet high in fiber. B. Exposure to radon. C. History of pneumonia. D. Use of antihistamines. Answer: B. Exposure to radon. Rationale: radon exposure is a well-known risk factor for the development of lung cancer. Question 16. A patient presents to the ER with sudden onset of sharp, stabbing chest pain that worsens with deep breathing. What condition should the nurse suspect? A. Asthma. B. Pleurisy. C. Bronchitis. D. Pneumonia. Answer: B. Pleurisy. Rationale: pleurisy involves inflammation of the pleura and can cause sharp, stabbing chest pain that intensifies with deep breathing. Question 17. What should the nurse monitor in a patient diagnosed with pulmonary edema? A. Increased urine output. B. Barrel chest. C. Pink frothy sputum. D. Wheezing. Answer, C. Pink frothy sputum. Rationale. Pink frothy sputum is a classic sign of pulmonary edema due to the presence of blood-tinged fluid in the alveoli. Question 18. A nurse is reviewing a patient's arterial blood gases, ABGs. Which result indicates respiratory acidosis? A. pH 7.48, PaCO2 is 32 mm of mercury. B. pH 7.30, PaCO2 is 50 mm of mercury. C. pH 7.44, PaCO2 is 40 mm of mercury. D. pH 7.50, PaCO2 is 28 mm of mercury. Answer, B. pH 7.30, PaCO2 is 50 mm of mercury. Rationale. Respiratory acidosis is characterized by a decreased pH and elevated PaCO2. Question 19. Which technique should a nurse use when performing percussion during a respiratory assessment? A. Striking the chest directly with the palm. B. Using the fingertips to tap the chest wall. C. Striking the back with a closed fist. D. Using the middle finger of one hand to strike the middle finger of the other hand against the chest. Answer, D. Using the middle finger of one hand to strike the middle finger of the other hand against the chest. Rationale. This technique allows the nurse to evaluate resonance and identify any areas of dullness or hyperresonance. Question 20. Which medication would be most appropriate for a patient with an acute asthma attack? A. Ipratropium bromide. B. Fluticasone. C. Albuterol. D. Monteliacast. Answer, C. Albuterol. Rationale. Albuterol is a short-acting beta agonist and provides rapid bronchodilation, making it appropriate for acute asthma exacerbations. Question 21. What recommendation should a nurse give to a patient with COPD to improve their nutritional status? A. Consume large meals 3 times a day. B. Increase your intake of carbohydrates. C. Eat small, frequent meals throughout the day. D. Limit fluid intake to reduce the sensation of fullness. Answer, C. Eat small, frequent meals throughout the day. Rationale. Small, frequent meals can prevent early satiety and reduce the effort required for breathing during meal times for COPD patients. Question 22. In a patient with suspected pulmonary embolism, which diagnostic test should the nurse anticipate? A. Bronchoscopy. B. Chest X-ray. C. Pulmonary function tests. D. CT pulmonary angiography. Answer, D. CT pulmonary angiography. Rationale. CT pulmonary angiography is the gold standard for diagnosing pulmonary embolism. Question 23. Which instruction should a nurse emphasize to a patient who recently had a tonsillectomy? A. Gargle with warm salt water. B. Drink hot beverages to soothe your throat. C. Avoid drinking through straws. D. Eat spicy foods to stimulate healing. Answer, C. Avoid drinking through straws. Rationale. Using a straw can cause injury to the surgical site and increase the risk of bleeding. Question 24. A nurse is caring for a patient with atelectasis. What intervention would be appropriate? A. Encourage the use of incentive spirometry. B. Increase fluid intake to thin secretions. C. Administer cough suppressants regularly. D. Initiate bed rest and limit activity. Answer A. Encourage the use of incentive spirometry. Rationale: incentive spirometry can help re-expand the alveoli and improve lung function. Question 25. When assessing a patient with a history of smoking, the nurse hears a low-pitched, rumbling sound on expiration. How should the nurse document this finding? A. Wheeze. B. Crackles. C. Ronchi. D. Stridor. Answer C. Ronchi. Rationale: ronchi are low-pitched, rumbling sounds that are often associated with mucus in the bronchial airways. Visit nurse study.
Hi everyone, this is Nurse Anna from nursestudy.net, and here we have 75 questions regarding the respiratory system and disorders with the answers and rationale.
Would you like free audiobooks? Click the link in the description. Question 1. A 70-year-old patient with a history of chronic obstructive pulmonary disease, COPD, is admitted to the hospital with worsening dyspnea and a productive cough. The nurse notes the patient has a respiratory rate of 28 breaths per minute, and auscultation reveals wheezing and decreased breath sounds. Which of the following nursing interventions is most appropriate initially? A. Administer oxygen via nasal cannula at 2 liters per minute. B. Prepare for endotracheal intubation. C. Encourage the patient to perform pursed lip breathing. D. Obtain a sputum culture for analysis. Answer A. Administer oxygen via nasal cannula at 2 liters per minute. Rationale: in patients with COPD, maintaining adequate oxygenation is crucial. Administering oxygen at a low flow rate helps to avoid suppressing the patient's respiratory drive while improving oxygen saturation. Pursed lip breathing, C, can help but is not the initial priority. Preparing for intubation, B, is premature without further assessment, and obtaining a sputum culture, D, is important but not the first step in an acute situation. Question 2. A patient with pneumonia is receiving IV antibiotics. The nurse is reviewing the patient's most recent arterial blood gas, ABG, results, pH 7.30, PaCO2 50 mm of mercury, HCO3 is 24 milliequivalent per liter. Which of the following actions should the nurse take first? A. Increase the oxygen flow rate. B. Notify the healthcare provider. C. Assist the patient in deep breathing exercises. D. Administer sodium bicarbonate. Answer B. Notify the healthcare provider. Rationale: the ABG results indicate respiratory acidosis, which suggests the patient is not ventilating adequately. The healthcare provider needs to be notified to assess the patient and potentially adjust the treatment plan. Increasing the oxygen flow rate, A, without provider guidance could lead to further issues. Deep breathing exercises, C, can be helpful but are not the first priority, and administering sodium bicarbonate, D, is not appropriate in this context as the primary issue is respiratory, not metabolic. Question 3. A patient with asthma is experiencing an acute exacerbation. The nurse notes that the patient is using accessory muscles to breathe, has an oxygen saturation of 88%, and is unable to speak in full sentences. Which of the following is the nurse's priority intervention? A. Administer a short-acting beta-agonist, SABA, inhaler. B. Perform chest physiotherapy. C. Place the patient in a high Fowler's position. D. Prepare for mechanical ventilation. Answer A. Administer a short-acting beta-agonist, SABA, inhaler. Rationale: administering a SABA inhaler, such as albuterol, is the priority as it will help to quickly relieve bronchospasm and improve airway patency. Placing the patient in a high Fowler's position, C, can help with breathing but is secondary to medication administration. Chest physiotherapy, B, is not appropriate during an acute asthma exacerbation, and preparing for mechanical ventilation, D, may be necessary if the patient does not respond to initial treatment but is not the first step. Question 4. A 60-year-old patient with a history of pulmonary fibrosis presents with increasing shortness of breath and dry cough. The patient is receiving supplemental oxygen at 4 liters per minute via nasal cannula, but continues to have low oxygen saturation levels. What is the most appropriate nursing action? A. Increase the oxygen flow rate to 6 liters per minute. B. Encourage the patient to use an incentive spirometer. C. Prepare for non-invasive positive pressure ventilation, NIPPV. D. Administer a bronchodilator nebulizer treatment. Answer. C. Prepare for non-invasive positive pressure ventilation, NIPPV. Rationale: for a patient with pulmonary fibrosis experiencing worsening respiratory status despite supplemental oxygen, NIPPV can provide better oxygenation and support ventilation without intubation. Increasing the oxygen flow rate, A, may not be effective due to the underlying pathology. Incentive spirometry, B, is more useful in preventing atelectasis postoperatively, and a bronchodilator, D, might not be effective in fibrotic lung disease. Question 5. A patient with acute respiratory distress syndrome, ARDS, is on a mechanical ventilator. The nurse notes that the patient's peak inspiratory pressure has been steadily increasing. What is the most appropriate initial nursing action? A. Suction the patient's endotracheal tube. B. Increase the tidal volume on the ventilator. C. Check the ventilator tubing for kinks or obstructions. D. Administer a sedative to the patient. Answer. C. Check the ventilator tubing for kinks or obstructions. Rationale: an increase in peak inspiratory pressure can be caused by an obstruction in the ventilator tubing or patient airway. Checking for kinks or obstructions is a simple and quick way to identify and potentially resolve the issue. Suctioning the patient, A, is appropriate if there are secretions, but checking the tubing should come first. Increasing the tidal volume, B, is not appropriate without addressing the cause of the increased pressure and administering a sedative. D, does not address the potential mechanical issue. Question 6. A 55-year-old patient with a history of heart failure is admitted with acute pulmonary edema. The patient is extremely anxious, with a respiratory rate of 32 breaths per minute and a frothy pink sputum. Which of the following medications should the nurse anticipate the healthcare provider to order first? A. Furosemide, Lasix. B. Morphine. C. Albuterol. D. Norepinephrine. Answer. A. Furosemide, Lasix. Rationale: furosemide, a loop diuretic, will help reduce pulmonary congestion by promoting diuresis. Morphine, B, can help reduce anxiety and decrease preload, but it is not the first-line treatment. Albuterol, C, is not indicated for pulmonary edema, and norepinephrine, D, is used for hypotension and shock, not for pulmonary edema. Question 7. A 40-year-old patient with cystic fibrosis presents with increased shortness of breath, fever, and thick, green sputum. The patient is currently receiving chest physiotherapy and pancreatic enzyme supplements. What is the priority nursing action? A. Increase the frequency of chest physiotherapy sessions. B. Obtain a sputum culture for bacterial analysis. C. Administer intravenous antibiotics as ordered. D. Encourage the patient to perform deep breathing exercises. Answer. C. Administer intravenous antibiotics as ordered. Rationale: the priority in this scenario is to treat the infection causing the patient's symptoms. Administering antibiotics is crucial to managing the infection. Increasing chest physiotherapy, A, and deep breathing exercises, D, are supportive measures, but treating the infection is primary. Obtaining a sputum culture, B, is important but should not delay the administration of antibiotics. Question 8. A patient with chronic bronchitis is admitted with an acute exacerbation. The nurse notes the patient has a productive cough, wheezing, and cyanosis. Which of the following ABG results would the nurse expect to find in this patient? A. pH 7.50, PaCO2 30 mm of mercury, HCO3 22 milliequivalent per liter. B. pH 7.35, PaCO2 45 mm of mercury, HCO3 26 milliequivalent per liter. C. pH 7.30, PaCO2 60 mm of mercury, HCO3 28 milliequivalent per liter. D. pH 7.45, PaCO2 40 mm of mercury, HCO3 24 milliequivalent per liter. Answer. C. pH 7.30, PaCO2 60 mm of mercury, HCO3 28 milliequivalent per liter. Rationale: chronic bronchitis often leads to respiratory acidosis due to hypoventilation and carbon dioxide retention. Therefore, a lower pH and elevated PaCO2 with a compensatory increase in HCO3 is expected. Options A and D indicate respiratory alkalosis or normal values, and B represents normal ABG values. Question 9. A patient with tuberculosis, TB, is started on isoniazid, INH, and rifampin. The nurse provides patient education on these medications. Which statement by the patient indicates a need for further teaching? A. I will need to take these medications for at least 6 months. B. I should avoid alcohol while taking these medications. C. I can stop taking the medications once my symptoms improve. D. I need to report any yellowing of my skin or eyes to my healthcare provider. Answer. C. I can stop taking the medications once my symptoms improve. Rationale: TB treatment requires strict adherence to the medication regimen for the entire duration prescribed, even if symptoms improve, to prevent resistance and ensure eradication of the bacteria. Statements A, B, and D are correct and show understanding of the medication regimen and potential side effects. Question 10. A patient with a recent diagnosis of lung cancer is experiencing a pleural effusion. The patient is scheduled for a thoracentesis. Which of the following should the nurse include in the pre-procedure teaching? A. The procedure will be performed under general anesthesia. B. The patient will need to lie on their side during the procedure. C. The procedure involves inserting a needle into the pleural space to remove fluid. D. The patient should avoid eating or drinking for 12 hours before the procedure. Answer. C. The procedure involves inserting a needle into the pleural space to remove fluid. Rationale: thoracentesis involves the insertion of a needle into the pleural space to remove fluid. The procedure is usually performed under local anesthesia. A is incorrect. The patient is typically positioned sitting upright and leaning forward. B is incorrect, and there are no specific fasting requirements. D is incorrect. Question 11. A 65-year-old patient with a history of smoking presents with hemoptysis, weight loss, and chronic cough. A chest X-ray reveals a mass in the right lung. What is the priority nursing intervention for this patient? A. Educate the patient on smoking cessation. B. Prepare the patient for a bronchoscopy. C. Encourage the patient to increase fluid intake. D. Schedule the patient for pulmonary rehabilitation. Answer. B. Prepare the patient for a bronchoscopy. Rationale: a bronchoscopy will allow for direct visualization of the mass and enable biopsy for definitive diagnosis. Smoking cessation education, A, is important but not the priority at this moment. Increasing fluid intake, C, and pulmonary rehabilitation, D, are supportive measures but secondary to obtaining a diagnosis. Question 12. A patient with pulmonary embolism, PE, is started on intravenous heparin. The nurse is monitoring the patient's lab results. Which lab value is the nurse most concerned with to evaluate the effectiveness of heparin therapy? A. Platelet count. B. Hemoglobin level. C. Activated partial thromboplastin time, APTT. D. Prothrombin time, PT. Answer. C. Activated partial thromboplastin time, APTT. Rationale: APTT is used to monitor the effectiveness of heparin therapy and to ensure the patient is within the therapeutic range. Platelet count, A, hemoglobin level, B, and PT, D, are important but do not specifically monitor heparin effectiveness. Question 13. A patient with newly diagnosed pulmonary hypertension is started on a calcium channel blocker. Which of the following is the most important patient teaching point for this medication? A. Take your medication with a full glass of water. B. Monitor your blood pressure regularly. C. Avoid grapefruit juice while taking this medication. D. Report any swelling of the ankles or feet to your healthcare provider. Answer. B. Monitor your blood pressure regularly. Rationale: calcium channel blockers can lower blood pressure, and regular monitoring is important to prevent hypotension. Taking medication with water, A, is good advice but not the most critical. Avoiding grapefruit juice, C, is important but secondary, and reporting swelling, D, is also important but not the priority teaching point. Question 14. A patient is admitted with an acute exacerbation of chronic bronchitis. The patient has a history of smoking and presents with increased sputum production, wheezing, and hypoxemia. Which of the following medications should the nurse anticipate administering first? A. Inhaled corticosteroid. B. Long-acting beta-agonist, LABA. C. Short-acting beta-agonist, SABA. D. Oral theophylline. Answer. C. Short-acting beta-agonist, SABA. Rationale: a SABA, such as albuterol, is used for quick relief of bronchospasm and wheezing in an acute exacerbation. Inhaled corticosteroids, A, and LABAs, B, are used for long-term management, and theophylline, D, is not typically used for acute exacerbations. Question 15. A patient with advanced stage lung cancer is experiencing severe dyspnea and anxiety. The healthcare provider orders morphine sulfate. What is the primary reason for administering morphine in this case? A. To reduce pain. B. To relieve anxiety. C. To decrease the sensation of dyspnea. D. To reduce coughing. Answer. C. To decrease the sensation of dyspnea. Rationale: morphine can reduce the sensation of breathlessness, which is particularly important for patients with severe dyspnea. While it also reduces pain, A, and anxiety, B, the primary reason in this context is to alleviate dyspnea. It does not specifically reduce coughing, D. Question 16. A 30-year-old patient with asthma is being discharged with a new prescription for an inhaled corticosteroid. Which statement by the patient indicates a need for further teaching? A. I should use this inhaler every day, even if I feel well. B. I need to rinse my mouth after using this inhaler. C. I can use this inhaler for quick relief during an asthma attack. D. I should not stop using this inhaler without consulting my healthcare provider. Answer. C. I can use this inhaler for quick relief during an asthma attack. Rationale: inhaled corticosteroids are for long-term control and not for quick relief during an asthma attack. Quick relief is provided by short-acting beta-agonists. Statements A, B, and D indicate correct understanding. Question 17. A patient with interstitial lung disease is experiencing worsening dyspnea and fatigue. The nurse notes crackles upon auscultation. Which diagnostic test is most likely to provide definitive information about the extent of the disease? A. Chest X-ray. B. Pulmonary function tests, PFTs. C. High-resolution CT scan. D. Arterial blood gas, ABG, analysis. Answer. C. High-resolution CT scan. Rationale: high-resolution CT scans provide detailed images of the lung tissue and are most useful in diagnosing and assessing the extent of interstitial lung disease. Chest X-ray, A, and PFTs, B, are helpful, but not as definitive. ABG analysis, D, evaluates gas exchange, but does not provide detailed information about lung tissue. Question 18. A patient with suspected pneumothorax presents with sudden onset of chest pain and dyspnea. The nurse observes tracheal deviation to the left side. Which of the following interventions should the nurse anticipate? A. Administration of high-flow oxygen. B. Chest tube insertion. C. Needle decompression. D. Administration of analgesics. Answer. C. Needle decompression. Rationale: tracheal deviation in the context of a suspected pneumothorax indicates tension pneumothorax, which is a medical emergency. Needle decompression is performed to relieve the pressure immediately. High-flow oxygen, A, and chest tube insertion, B, are important but follow initial emergency decompression. Analgesics, D, are supportive but not the primary intervention. Question 19. A patient with a history of COPD is prescribed tiotropium, Spiriva. Which of the following instructions should the nurse include in the patient teaching? A. Use this inhaler during an acute asthma attack. B. Rinse your mouth after using this inhaler. C. This medication should be taken once daily. D. Increase your fluid intake while using this medication. Answer. C. This medication should be taken once daily. Rationale: tiotropium is a long-acting anticholinergic that is taken once daily for maintenance therapy in COPD. It is not for use during acute attacks. A. Rinsing the mouth, B, is typically advised with inhaled corticosteroids to prevent oral thrush, not necessary for anticholinergics. Increasing fluid intake, D, is generally good advice, but not specific to tiotropium. Question 20. A 45-year-old patient with sarcoidosis is experiencing worsening cough and shortness of breath. The nurse reviews the patient's lab results and notes elevated calcium levels. What is the most appropriate nursing intervention? A. Encourage increased fluid intake. B. Prepare the patient for a bronchoscopy. C. Administer intravenous corticosteroids. D. Educate the patient about a low-calcium diet. Answer. A. Encourage increased fluid intake. Rationale: elevated calcium levels can be a complication of sarcoidosis. Increasing fluid intake helps to dilute the calcium and prevent kidney stones. Preparing for bronchoscopy, B, or administering corticosteroids, C, may be necessary for the disease management but are not directly related to hypercalcemia management. Educating about a low-calcium diet, D, is also important but not the immediate priority. Question 21. A patient with acute respiratory failure is receiving mechanical ventilation. The nurse notices a sudden drop in the patient's oxygen saturation and an increase in peak airway pressures. Which of the following should the nurse do first? A. Check the patient's endotracheal tube for displacement. B. Increase the oxygen flow rate. C. Administer a bronchodilator. D. Call the respiratory therapist for assistance. Answer. A. Check the patient's endotracheal tube for displacement. Rationale: a sudden drop in oxygen saturation and increased airway pressures can indicate a problem with the endotracheal tube, such as displacement or obstruction. Checking the tube should be the first action. Increasing oxygen flow rate, B, or administering a bronchodilator, C, does not address the potential cause. Calling for assistance, D, is appropriate but comes after initial assessment. Question 22. A patient with pulmonary embolism is receiving anticoagulant therapy. The nurse notes that the patient's activated partial thromboplastin time, APTT, is significantly elevated. What is the most appropriate action? A. Continue the current heparin infusion rate. B. Administer protamine sulfate. C. Increase the heparin infusion rate. D. Notify the healthcare provider. Answer: D. Notify the healthcare provider. Rationale: a significantly elevated APTT indicates that the patient is at risk for bleeding complications. The healthcare provider needs to be notified to adjust the heparin dosage or consider other interventions. Continuing the current infusion rate, A, or increasing it, C, would increase the risk of bleeding. Administering protamine sulfate, B, is an antidote for heparin overdose but should only be done under the provider's direction. Question 23. A patient with advanced emphysema is experiencing severe dyspnea at rest. The nurse notes a barrel chest and pursed lip breathing. Which of the following should be the primary goal for this patient's care? A. Increase physical activity levels. B. Maintain adequate oxygenation. C. Reduce fluid intake. D. Encourage smoking cessation. Answer: B. Maintain adequate oxygenation. Rationale: the primary goal for a patient with advanced emphysema is to maintain adequate oxygenation. Physical activity, A, and smoking cessation, D, are important but secondary. Reducing fluid intake, C, is not typically a primary goal for emphysema unless there are other specific medical indications. Question 24. A 50-year-old patient with a history of asthma is admitted with status asthmaticus. The patient is receiving continuous, nebulized albuterol. The nurse notes a heart rate of 120 beats per minute and palpitations. What is the most appropriate nursing action? A. Stop the albuterol treatment immediately. B. Notify the healthcare provider and continue to monitor. C. Administer a dose of a beta blocker. D. Switch to an oral form of albuterol. Answer: B. Notify the healthcare provider and continue to monitor. Rationale: albuterol can cause tachycardia and palpitations as side effects. The healthcare provider should be notified, and the patient should be monitored closely. Stopping the treatment immediately, A, could worsen the asthma symptoms. Administering a beta blocker, C, could exacerbate asthma, and switching to an oral form, D, would not address the acute situation. Question 25. A patient with bronchiectasis is admitted with a productive cough and thick, foul-smelling sputum. Which diagnostic test is most important to determine the causative agent of the infection? A. Sputum culture and sensitivity. B. Chest X-ray. C. Complete blood count, CBC. D. Arterial blood gas, ABG, analysis. Answer: A. Sputum culture and sensitivity. Rationale: a sputum culture and sensitivity test will identify the causative agent of the infection and determine the most effective antibiotic therapy. A chest X-ray, B, can show structural changes but not the causative agent. CBC, C, can indicate infection but not the specific pathogen. ABG analysis, D, assesses gas exchange but not the pathogen. Question 26. A patient with cystic fibrosis, CF, is admitted with an acute pulmonary exacerbation. The nurse is preparing to administer Dornase alpha, pulmozyme. What is the primary action of this medication? A. Reduces airway inflammation. B. Thins and loosens mucus in the airways. C. Prevents bacterial infections. D. Dilates the bronchioles. Answer: B. Thins and loosens mucus in the airways. Rationale: Dornase alpha is a mucolytic agent that helps to thin and loosen mucus in the airways, improving clearance and reducing the risk of infection. It does not directly reduce inflammation, A. Prevent infections, C. Or dilate bronchioles, D. Question 27. A patient with pneumonia is receiving supplemental oxygen via nasal cannula at 4 liters per minute. The nurse notes the patient is still experiencing dyspnea and has an oxygen saturation of 90%. Which of the following actions should the nurse take next? A. Increase the oxygen flow rate to 6 liters per minute. B. Switch to a non-rebreather mask. C. Administer a bronchodilator. D. Reposition the patient to a high Fowler's position. Answer: B. Switch to a non-rebreather mask. Rationale: switching to a non-rebreather mask will deliver a higher concentration of oxygen to the patient. Increasing the flow rate of the nasal cannula, A. may not be sufficient. Administering a bronchodilator, C. may help if bronchospasm is present but is not the first action. Repositioning to a high Fowler's position, D. can help with breathing but is secondary to increasing oxygen delivery. Question 28. A patient with idiopathic pulmonary fibrosis is prescribed pirfenidone, Esbriet. Which of the following should the nurse include in the patient's education about this medication? A. Take this medication on an empty stomach. B. This medication will cure your condition. C. Avoid excessive sun exposure while taking this medication. D. You will need regular blood tests to monitor kidney function. Answer: C. Avoid excessive sun exposure while taking this medication. Rationale: pirfenidone can increase sensitivity to sunlight, so patients should avoid excessive sun exposure and use sun protection. It should be taken with food to reduce gastrointestinal side effects. A is incorrect. The medication helps to slow disease progression but does not cure it. B is incorrect. Regular liver function tests are required. D is partially correct, but kidney function is not the primary concern. Question 29. A patient with a suspected pulmonary embolism is scheduled for a ventilation perfusion (VQ) scan. What is the purpose of this diagnostic test? A. To assess the oxygen and carbon dioxide levels in the blood. B. To detect areas of the lungs that are receiving too little air or blood flow. C. To measure lung volumes and capacities. D. To visualize the blood vessels in the lungs. Answer: B. To detect areas of the lungs that are receiving too little air or blood flow. Rationale: a VQ scan helps to identify areas of the lungs with mismatched ventilation and perfusion, which is useful in diagnosing pulmonary embolism. It does not directly assess blood gas levels. A. Measure lung volumes. C. Or visualize blood vessels. D. Question 30. A patient with obstructive sleep apnea, OSA, is being treated with continuous positive airway pressure, CPAP. The nurse provides education on the use of CPAP. Which statement by the patient indicates a need for further teaching? A. I should use my CPAP machine every night, even if I feel fine. B. The CPAP machine will keep my airways open while I sleep. C. I can stop using the CPAP machine if I lose weight. D. I need to clean the CPAP mask and tubing regularly. Answer: C. I can stop using the CPAP machine if I lose weight. Rationale: while weight loss can improve OSA symptoms, it does not guarantee that CPAP will no longer be needed. Patients should continue using CPAP unless otherwise directed by their healthcare provider. Statements A, B, and D indicate correct understanding. Question 31. A patient with advanced chronic obstructive pulmonary disease, COPD, is experiencing respiratory failure and is placed on mechanical ventilation. The healthcare provider orders a spontaneous breathing trial, SBT. What is the purpose of an SBT? A. To measure the patient's lung capacity. B. To assess the patient's ability to breathe without ventilatory support. C. To determine the effectiveness of bronchodilator therapy. D. To evaluate the patient's gas exchange efficiency. Answer. B. To assess the patient's ability to breathe without ventilatory support. Rationale: an SBT is conducted to assess whether a patient can breathe independently without mechanical ventilation. It does not measure lung capacity, A, determine bronchodilator effectiveness, C, or evaluate gas exchange efficiency, D, directly. Question 32. A patient with pleuritis is experiencing severe pleuritic chest pain. Which of the following interventions is most appropriate to manage the patient's pain? A. Administering nonsteroidal anti-inflammatory drugs, NSAIDs. B. Encouraging deep breathing exercises. C. Applying heat to the chest. D. Providing oxygen therapy. Answer. A. Administering nonsteroidal anti-inflammatory drugs, NSAIDs. Rationale: NSAIDs are effective in managing pleuritic pain due to their anti-inflammatory properties. Deep breathing exercises, B, can help with lung expansion but may increase pain. Applying heat, C, is not typically recommended for pleuritic pain, and oxygen therapy, D, addresses hypoxemia, not pain. Question 33. A patient with lung cancer is receiving palliative care and is experiencing dyspnea. The nurse notes the patient is anxious and breathing rapidly. Which of the following interventions is most appropriate to help relieve the patient's dyspnea? A. Increasing the oxygen flow rate. B. Administering a bronchodilator. C. Providing low-dose morphine. D. Positioning the patient flat. Answer. C. Providing low-dose morphine. Rationale: low-dose morphine is effective in relieving dyspnea by decreasing the sensation of breathlessness and reducing anxiety. Increasing the oxygen flow rate, A, might help but is not always effective for dyspnea of terminal lung disease. Administering a bronchodilator, B, is not appropriate unless bronchospasm is present. Positioning the patient flat, D, can worsen dyspnea. Question 34. A patient with a suspected pneumothorax is undergoing a chest tube insertion. The nurse's role during this procedure includes: A. Administering sedation and analgesia as ordered. B. Assisting with the insertion by holding the patient still. C. Ensuring all necessary equipment is sterile and ready. D. Monitoring the patient's vital signs and oxygen saturation. Answer. D. Monitoring the patient's vital signs and oxygen saturation. Rationale: monitoring the patient's vital signs and oxygen saturation is crucial during chest tube insertion to detect any complications. Administering sedation and analgesia, A, and assisting with the procedure, B, are important but secondary roles. Ensuring sterile equipment, C, is the responsibility of the entire team but is not the primary nursing role. Question 35. A patient with chronic obstructive pulmonary disease, COPD, is prescribed roflumilast, Daliresp. What is the primary action of this medication? A. Reduces airway inflammation. B. Dilates the bronchioles. C. Thins mucus secretions. D. Prevents bacterial infections. Answer. A. Reduces airway inflammation. Rationale: roflumilast is a phosphodiesterase 4 inhibitor that reduces airway inflammation, which can help prevent COPD exacerbations. It does not dilate bronchioles, B. Thin mucus, C. Or prevent bacterial infections, D. Question 36. A patient with pulmonary arterial hypertension, PAH, is prescribed bosentan, Tracler. What important laboratory test should the nurse monitor while the patient is on this medication? A. Complete blood count, CBC. B. Liver function tests, LFTs. C. Renal function tests. D. Coagulation profile. Answer. B. Liver function tests, LFTs. Rationale: bosentan can cause liver toxicity, so regular monitoring of liver function tests is essential. While CBC, A, renal function, C, and coagulation profile, D, are important, they are not specifically indicated for monitoring bosentan therapy. Question 37. A patient with pulmonary embolism is receiving low molecular weight heparin, LMWH, therapy. The nurse teaches the patient about this medication. Which statement by the patient indicates a need for further teaching? A. I need to inject this medication into the fatty tissue of my abdomen. B. I should avoid taking aspirin or other NSAIDs without consulting my healthcare provider. C. I will need regular blood tests to monitor my APTT levels. D. I should watch for signs of bleeding, such as unusual bruising or bleeding gums. Answer. C. I will need regular blood tests to monitor my APTT levels. Rationale: LMWH does not require regular monitoring of APTT levels, unlike unfractionated heparin. Statements A, B, and D indicate correct understanding. Question 38. A patient with a history of asthma is using a peak flow meter at home. Which of the following instructions should the nurse include in the patient teaching? A. Use the peak flow meter before taking any asthma medications. B. Record the highest of 3 readings each time you use the meter. C. Use the peak flow meter once a week. D. Perform the test while lying down for best results. Answer. B. Record the highest of 3 readings each time you use the meter. Rationale: the correct procedure for using a peak flow meter includes recording the highest of 3 readings. The meter should be used daily, C is incorrect, and the test should be performed standing or sitting up, not lying down, D. The meter is typically used after taking medications to monitor their effectiveness, A is incorrect. Question 39. A patient with advanced chronic obstructive pulmonary disease, COPD, is experiencing hypercapnic respiratory failure. The nurse is preparing to initiate non-invasive positive pressure ventilation, NIPPV. What is the primary goal of NIPPV in this patient? A. To increase oxygenation. B. To reduce carbon dioxide levels. C. To improve lung compliance. D. To prevent the need for intubation. Answer. B. To reduce carbon dioxide levels. Rationale: the primary goal of NIPPV in hypercapnic respiratory failure is to reduce carbon dioxide levels by improving ventilation. While it may also improve oxygenation, A, and prevent the need for intubation, D, the main purpose is to address hypercapnia. Improving lung compliance, C, is not the primary goal. Question 40. A patient with advanced stage lung cancer is experiencing significant pleural effusion. Which of the following symptoms would the nurse expect to find on assessment? A. Decreased breath sounds on the affected side. B. Increased firmness on the affected side. C. Hyperresonance to percussion on the affected side. D. Bilateral crackles. Answer. A. Decreased breath sounds on the affected side. Rationale: pleural effusion typically causes decreased breath sounds on the affected side due to fluid in the pleural space. Increased firmness, B, and hyperresonance, C, are not expected findings in pleural effusion. Bilateral crackles, D, would suggest a different pathology, such as heart failure. Question 41. A patient with acute respiratory distress syndrome, ARDS, is being treated with mechanical ventilation and positive end expiratory pressure, PEEP. The nurse notes a sudden drop in blood pressure. What is the most likely cause of this finding? A. Increased intrathoracic pressure from PEEP. B. Hypovolemia due to fluid shifts. C. Adverse reaction to sedative medications. D. Increased oxygen demand by the tissues. Answer: A. Increased intrathoracic pressure from PEEP. Rationale: PEEP can increase intrathoracic pressure, which can decrease venous return to the heart and result in a drop in blood pressure. Hypovolemia, B. Adverse reactions to medications, C. And increased oxygen demand, D. Are less likely causes in this scenario. Question 42. A patient with pulmonary hypertension is experiencing right-sided heart failure. Which of the following symptoms should the nurse expect to find on assessment? A. Crackles in the lungs. B. Peripheral edema. C. Elevated left atrial pressure. D. Decreased central venous pressure. Answer: B. Peripheral edema. Rationale: right-sided heart failure commonly leads to peripheral edema due to venous congestion. Crackles in the lungs, A, and elevated left atrial pressure, C, are more indicative of left-sided heart failure. Decreased central venous pressure, D, would not be expected, it would more likely be increased. Question 43. A patient with advanced COPD is prescribed supplemental oxygen at home. Which of the following statements by the patient indicates a need for further teaching? A. I should use my oxygen all the time, even when I'm feeling fine. B. I can adjust the flow rate if I feel short of breath. C. I need to keep my oxygen equipment away from open flames. D. I should notify my healthcare provider if I experience increased shortness of breath. Answer: B. I can adjust the flow rate if I feel short of breath. Rationale: patients should not adjust their oxygen flow rate without consulting their healthcare provider. Statements A, C, and D indicate correct understanding. Question 44. A patient with acute respiratory failure is on mechanical ventilation. The nurse notes an increase in the patient's peak airway pressures. What is the most appropriate initial nursing action? A. Check for kinks in the ventilator tubing. B. Increase the tidal volume. C. Administer a bronchodilator. D. Suction the patient's airway. Answer: A. Check for kinks in the ventilator tubing. Rationale: checking for kinks or obstructions in the ventilator tubing is the first step when peak airway pressures increase. Increasing the tidal volume, B, is not appropriate without further assessment. Administering a bronchodilator, C, or suctioning the airway, D, may be necessary but should follow checking the tubing. Question 45. A patient with pneumocystis pneumonia, PCP, is receiving trimethoprim sulfamethoxazole, Bactrim. Which of the following adverse effects should the nurse monitor for? A. Hyperkalemia. B. Hypoglycemia. C. Hypotension. D. Hypernatremia. Answer: A. Hyperkalemia. Rationale: trimethoprim sulfamethoxazole can cause hyperkalemia as an adverse effect. Hypoglycemia, B, hypotension, C, and hypernatremia, D, are not commonly associated with this medication. Question 46. A patient with severe acute respiratory distress syndrome, ARDS, is being managed with prone positioning. What is the primary benefit of prone positioning in ARDS? A. Increases lung compliance. B. Improves oxygenation. C. Reduces carbon dioxide levels. D. Enhances pulmonary blood flow. Answer B. Improves oxygenation. Rationale: prone positioning helps to improve oxygenation by redistributing blood flow and ventilation, reducing ventilator-associated lung injury, and improving overall gas exchange. Increasing lung compliance, A, and enhancing pulmonary blood flow, D, are secondary benefits. Reducing carbon dioxide levels, C, can be an outcome of improved oxygenation but is not the primary reason for prone positioning. Question 47. A patient with acute exacerbation of asthma is admitted to the emergency department. The nurse notes the patient has difficulty speaking, wheezing, and a respiratory rate of 36 breaths per minute. Which of the following is the priority nursing intervention? A. Administer intravenous corticosteroids. B. Provide humidified oxygen. C. Administer a short-acting beta agonist via nebulizer. D. Perform peak flow measurements. Answer C. Administer a short-acting beta agonist via nebulizer. Rationale: administering a short-acting beta agonist, such as albuterol, via nebulizer is the priority to rapidly relieve bronchospasm and improve airway patency. Intravenous corticosteroids, A, are important but not the immediate priority. Providing humidified oxygen, B, and performing peak flow measurements, D, are supportive measures but secondary to administering bronchodilators. Question 48. A patient with chronic bronchitis presents with increased sputum production, cyanosis, and dyspnea. The patient is prescribed azithromycin. What is the primary reason for prescribing this medication in chronic bronchitis? A. To reduce inflammation. B. To treat bacterial infection. C. To thin mucus secretions. D. To open the airways. Answer B. To treat bacterial infection. Rationale: azithromycin is an antibiotic prescribed to treat bacterial infections that can exacerbate chronic bronchitis. It does not primarily reduce inflammation, A, thin mucus, C, or open the airways, D. Question 49. A patient with pulmonary fibrosis is being treated with pirfenidone, Esbriet. The nurse monitors the patient for potential side effects. Which of the following side effects is most commonly associated with pirfenidone? A. Hypertension. B. Photosensitivity. C. Hyperglycemia. D. Renal insufficiency. Answer B. Photosensitivity. Rationale: photosensitivity is a common side effect of pirfenidone. Patients should be advised to avoid excessive sun exposure and use sun protection. Hypertension, A, hyperglycemia, C, and renal insufficiency, D, are not commonly associated with pirfenidone. Question 50. A patient with acute respiratory failure is receiving mechanical ventilation. The nurse notes a sudden drop in the patient's oxygen saturation and an increase in peak airway pressures. What is the most appropriate initial action? A. Check the endotracheal tube placement. B. Increase the oxygen concentration. C. Administer a bronchodilator. D. Perform a chest X-ray. Answer A. Check the endotracheal tube placement. Rationale: a sudden drop in oxygen saturation and increased airway pressures can indicate issues with the endotracheal tube, such as displacement or obstruction. Checking the placement and patency of the tube is the first step. Increasing oxygen concentration, B, and administering a bronchodilator, C, may be necessary but are secondary to ensuring proper tube placement. Performing a chest X-ray, D, is diagnostic but not the immediate priority. Question 51. A patient with a history of COPD is admitted with an acute exacerbation. The nurse notes that the patient's arterial blood gas, ABG, results are as follows: pH 7.32, PaCO2 55 mm of mercury, HCO3 28 milliequivalent per liter. Which of the following interventions is most appropriate? A. Administering sodium bicarbonate. B. Initiating non-invasive positive pressure ventilation, NIPPV. C. Increasing the oxygen flow rate. D. Encouraging the patient to use an incentive spirometer. Answer. B. Initiating non-invasive positive pressure ventilation, NIPPV. Rationale: the ABG results indicate respiratory acidosis with compensation, suggesting the patient is in respiratory distress. NIPPV can help improve ventilation and reduce CO2 levels. Administering sodium bicarbonate, A, is not appropriate for respiratory acidosis. Increasing the oxygen flow rate, C, might help but does not address ventilation. Using an incentive spirometer, D, is more preventive than corrective in acute exacerbations. Question 52. A patient with cystic fibrosis is admitted with an acute pulmonary exacerbation. The nurse notes the patient has a productive cough and thick, tenacious sputum. Which of the following medications should the nurse anticipate administering? A. Dornase alpha, Pulmozyme. B. Inhaled corticosteroids. C. Long-acting beta agonists. D. Systemic corticosteroids. Answer. A. Dornase alpha, Pulmozyme. Rationale: Dornase alpha is a mucolytic agent that helps to thin and loosen thick sputum, which is beneficial in cystic fibrosis. Inhaled corticosteroids, B, and long-acting beta agonists, C, are used for chronic management. Systemic corticosteroids, D, are used for severe exacerbations but are not first-line treatment for sputum management. Question 53. A patient with pulmonary hypertension is started on sildenafil, Revatio. Which of the following statements by the patient indicates a need for further teaching? A. I can take this medication with or without food. B. I should avoid taking nitrates while on this medication. C. I may experience headaches as a side effect. D. This medication will cure my pulmonary hypertension. Answer. D. This medication will cure my pulmonary hypertension. Rationale: sildenafil helps manage symptoms of pulmonary hypertension but does not cure the condition. Statements A, B, and C indicate correct understanding of the medication. Question 54. A patient with bronchiectasis is experiencing increased sputum production and dyspnea. The nurse plans to perform chest physiotherapy. Which of the following is the primary purpose of this intervention? A. To reduce airway inflammation. B. To loosen and mobilize secretions. C. To improve oxygenation. D. To prevent infection. Answer. B. To loosen and mobilize secretions. Rationale: chest physiotherapy is primarily used to loosen and mobilize secretions in patients with bronchiectasis, facilitating their clearance from the airways. It does not directly reduce inflammation, A, improve oxygenation, C, or prevent infection, D. Question 55. A patient with a history of asthma presents with wheezing and shortness of breath. The nurse administers a nebulized albuterol treatment. Which of the following side effects should the nurse monitor for? A. Bradycardia. B. Hypertension. C. Hyperkalemia. D. Tachycardia. Answer. D. Tachycardia. Rationale: albuterol, a beta agonist, can cause tachycardia as a common side effect. Bradycardia, A, hypertension, B, and hyperkalemia, C, are not typical side effects of albuterol. Question 56. A patient with chronic bronchitis is experiencing an acute exacerbation. The nurse notes the patient is cyanotic and has a respiratory rate of 30 breaths per minute. Which of the following nursing interventions is most appropriate initially? A. Administer a high-flow oxygen mask. B. Initiate intravenous corticosteroids. C. Perform chest physiotherapy. D. Administer a short-acting beta agonist via nebulizer. Answer: D. Administer a short-acting beta agonist via nebulizer. Rationale: administering a short-acting beta agonist via nebulizer will help relieve bronchospasm and improve airflow, which is crucial in an acute exacerbation. High-flow oxygen, A, should be used cautiously to avoid suppressing the respiratory drive in chronic bronchitis. Intravenous corticosteroids, B, and chest physiotherapy, C, are important but not the immediate priority. Question 57. A patient with suspected tuberculosis, TB, presents with a chronic cough, weight loss, and night sweats. Which of the following diagnostic tests is most definitive for confirming TB? A. Chest X-ray. B. Sputum culture. C. Tuberculin skin test, TST. D. Interferon gamma release assay, IGRA. Answer: B. Sputum culture. Rationale: a sputum culture is the most definitive test for confirming tuberculosis, as it directly identifies the presence of Mycobacterium tuberculosis. A chest X-ray, A, can suggest TB but is not definitive. TST, C, and IGRA, D, indicate exposure to TB but do not confirm active infection. Question 58. A patient with asthma is being discharged with a new prescription for a leukotriene receptor antagonist. Which of the following is the primary action of this medication? A. Reduces airway inflammation. B. Dilates the bronchioles. C. Thins mucus secretions. D. Prevents bacterial infections. Answer: A. Reduces airway inflammation. Rationale: leukotriene receptor antagonists, such as montelukast, reduce airway inflammation and prevent asthma exacerbations. They do not directly dilate bronchioles, B, thin mucus, C, or prevent bacterial infections, D. Question 59. A patient with advanced COPD is experiencing cor pulmonale. Which of the following symptoms should the nurse expect to find on assessment? A. Jugular vein distension. B. Bilateral crackles in the lungs. C. Hyperresonance to percussion. D. Decreased central venous pressure. Answer: A. Jugular vein distension. Rationale: cor pulmonale, or right-sided heart failure secondary to lung disease, often presents with jugular vein distension due to increased venous pressure. Bilateral crackles, B, and hyperresonance, C, are more indicative of lung pathology. Decreased central venous pressure, D, would not be expected. Question 60. A patient with pneumonia is receiving intravenous antibiotics. The nurse is monitoring the patient's response to treatment. Which of the following lab values is most important to monitor? A. White blood cell, WBC, count. B. Hemoglobin level. C. Platelet count. D. Serum electrolytes. Answer: A. White blood cell, WBC, count. Rationale: monitoring the WBC count helps assess the patient's response to antibiotic therapy and the resolution of infection. Hemoglobin level, B, platelet count, C, and serum electrolytes, D, are important but not directly related to infection monitoring. Question 61. A patient with pulmonary fibrosis is experiencing increased dyspnea and fatigue. The healthcare provider prescribes oxygen therapy. What is the primary goal of this therapy? A. To reduce carbon dioxide levels. B. To improve lung compliance. C. To maintain adequate oxygenation. D. To prevent respiratory infections. Answer: C. To maintain adequate oxygenation. Rationale: the primary goal of oxygen therapy in pulmonary fibrosis is to maintain adequate oxygenation. Reducing carbon dioxide levels, A, and improving lung compliance, B, are secondary concerns. Preventing respiratory infections, D, is important but not the primary goal of oxygen therapy. Question 62. A patient with a pleural effusion is scheduled for a thoracentesis. What is the primary purpose of this procedure? A. To obtain a tissue biopsy. B. To instill medication into the pleural space. C. To remove fluid from the pleural space. D. To measure pleural pressure. Answer: C. To remove fluid from the pleural space. Rationale: thoracentesis is performed to remove fluid from the pleural space, which can relieve symptoms and allow for diagnostic analysis of the fluid. It is not performed to obtain tissue biopsy, A, instill medication, B, or measure pleural pressure, D. Question 63. A patient with bronchiectasis is prescribed hypertonic saline nebulization. What is the primary action of this treatment? A. To reduce airway inflammation. B. To promote mucus clearance. C. To prevent bacterial infections. D. To dilate the airways. Answer: B. To promote mucus clearance. Rationale: hypertonic saline nebulization helps to hydrate and loosen mucus, promoting its clearance from the airways in patients with bronchiectasis. It does not primarily reduce inflammation, A, prevent infections, C, or dilate the airways, D. Question 64. A patient with pulmonary embolism, PE, is started on warfarin, Coumadin, therapy. The nurse teaches the patient about dietary considerations. Which of the following statements by the patient indicates correct understanding? A. I should increase my intake of green leafy vegetables. B. I need to avoid foods high in vitamin K. C. I should avoid eating dairy products. D. I can continue to drink alcohol in moderation. Answer: B. I need to avoid foods high in vitamin K. Rationale: warfarin's effectiveness can be affected by vitamin K intake. Patients should avoid sudden increases in foods high in vitamin K to maintain consistent blood levels. Increasing intake of green leafy vegetables, A, can interfere with warfarin. Dairy products, C, do not significantly affect warfarin. Alcohol intake, D, should be discussed with the healthcare provider, as it can affect medication metabolism. Question 65. A patient with idiopathic pulmonary fibrosis is being treated with nintedanib, OFEV. The nurse monitors the patient for which potential adverse effect? A. Hypertension. B. Hepatotoxicity. C. Hyperglycemia. D. Renal failure. Answer: B. Hepatotoxicity. Rationale: nintedanib can cause hepatotoxicity, so liver function should be monitored regularly. Hypertension, A, hyperglycemia, C, and renal failure, D, are not primary concerns with nintedanib. Question 66. A patient with pulmonary hypertension is receiving an infusion of epoprostenol, Flolon. Which of the following is the most important nursing consideration for this therapy? A. Monitoring blood pressure closely. B. Ensuring the infusion pump is functioning properly. C. Administering the infusion via peripheral IV. D. Monitoring for signs of hyperglycemia. Answer: B. Ensuring the infusion pump is functioning properly. Rationale: epoprostenol has a very short half-life, and interruptions in the infusion can cause rebound pulmonary hypertension, which can be life-threatening. Therefore, ensuring the infusion pump is functioning properly is critical. Monitoring blood pressure, A, is important but secondary. The infusion is typically administered via a central line, not peripheral IV, C. Monitoring for hyperglycemia, D, is not relevant to epoprostenol therapy. Question 67. A patient with severe asthma is prescribed omalizumab, Xolair. The nurse teaches the patient about this medication. Which statement by the patient indicates correct understanding? A. I will take this medication orally every day. B. I need to have regular blood tests to monitor my kidney function. C. I will receive this medication as an injection every 2 to 4 weeks. D. I can stop using my rescue inhaler once I start this medication. Answer. C. I will receive this medication as an injection every 2 to 4 weeks. Rationale: omalizumab is administered as a subcutaneous injection every 2 to 4 weeks. It is not taken orally, A, does not require regular kidney function tests, B, and does not replace the need for a rescue inhaler, D. Question 68. A patient with advanced COPD is experiencing chronic hypoxemia and polycythemia. Which of the following lab values would the nurse expect to find elevated? A. Hemoglobin. B. White blood cell count. C. Platelet count. D. Serum electrolytes. Answer. A. Hemoglobin. Rationale: chronic hypoxemia in COPD can lead to polycythemia, which is an increase in red blood cells and hemoglobin as a compensatory mechanism to improve oxygen transport. White blood cell count, B, platelet count, C, and serum electrolytes, D, are not typically elevated due to chronic hypoxemia. Question 69. A patient with cystic fibrosis is receiving tobramycin nebulization therapy. What is the primary purpose of this treatment? A. To reduce airway inflammation. B. To treat bacterial infections. C. To thin mucus secretions. D. To dilate the bronchioles. Answer. B. To treat bacterial infections. Rationale: tobramycin is an antibiotic used to treat bacterial infections in patients with cystic fibrosis. It does not primarily reduce inflammation, A, thin mucus, C, or dilate bronchioles, D. Question 70. A patient with acute respiratory distress syndrome, ARDS, is receiving mechanical ventilation with a high fraction of inspired oxygen FiO2. The nurse monitors the patient for potential complications. Which of the following is a common complication associated with high FiO2? A. Oxygen toxicity. B. Hypoventilation. C. Pulmonary embolism. D. Metabolic alkalosis. Answer. A. Oxygen toxicity. Rationale: high FiO2 levels can lead to oxygen toxicity, which can cause lung damage. Hypoventilation, B, pulmonary embolism, C, and metabolic alkalosis, D, are not directly associated with high FiO2. Question 71. A patient with pulmonary embolism, PE, is receiving thrombolytic therapy. The nurse monitors the patient for signs of bleeding. Which of the following is the most concerning finding? A. Hematuria. B. Epistaxis. C. Ecchymosis. D. Hemoptysis. Answer. D. Hemoptysis. Rationale: hemoptysis, or coughing up blood, is particularly concerning in a patient receiving thrombolytic therapy as it can indicate significant bleeding in the lungs. Hematuria, A, epistaxis, B, and ecchymosis, C, are also concerning but less immediately critical compared to hemoptysis. Question 72. A patient with interstitial lung disease is being evaluated for a lung transplant. Which of the following assessments is most important to determine the patient's eligibility for transplantation? A. Pulmonary function tests, PFTs. B. Arterial blood gas, ABG, analysis. C. 6-minute walk test. D. High-resolution CT scan. Answer: A. Pulmonary function tests, PFTs. Rationale: pulmonary function tests are critical in evaluating the extent of lung disease and the patient's respiratory capacity, which are key factors in determining eligibility for a lung transplant. ABG analysis, B, 6-minute walk test, C, and high-resolution CT scan, D, are also important but secondary to PFTs. Question 73. A patient with advanced lung cancer is experiencing superior vena cava, SVC, syndrome. Which of the following symptoms should the nurse expect to find? A. Facial edema and distended neck veins. B. Hypotension and tachycardia. C. Bilateral crackles in the lungs. D. Abdominal distension and jaundice. Answer: A. Facial edema and distended neck veins. Rationale: SVC syndrome occurs when the superior vena cava is compressed or obstructed, leading to facial edema, distended neck veins, and upper body swelling. Hypotension and tachycardia, B, are not typical symptoms. Bilateral crackles, C, and abdominal distension with jaundice, D, are indicative of other conditions. Question 74. A patient with chronic obstructive pulmonary disease, COPD, is prescribed inhaled tiotropium, Spiriva. What is the primary action of this medication? A. Reduces airway inflammation. B. Dilates the bronchioles. C. Thins mucus secretions. D. Prevents bacterial infections. Answer: B. Dilates the bronchioles. Rationale: tiotropium is a long-acting anticholinergic that helps to dilate the bronchioles, improving airflow in patients with COPD. It does not primarily reduce inflammation, A, thin mucus, C, or prevent infections, D. Question 75. A patient with pulmonary fibrosis is experiencing severe dyspnea and fatigue. The nurse notes the patient is on high-flow oxygen therapy. Which of the following is the most important nursing intervention? A. Monitor the patient for signs of oxygen toxicity. B. Encourage the patient to increase physical activity. C. Administer a bronchodilator. D. Perform chest physiotherapy. Answer: A. Monitor the patient for signs of oxygen toxicity. Rationale: high-flow oxygen therapy can lead to oxygen toxicity, so monitoring for signs such as confusion, restlessness, and respiratory distress is crucial. Increasing physical activity, B, may not be feasible due to the patient's condition. Administering a bronchodilator, C, and performing chest physiotherapy, D, are supportive measures but secondary to monitoring for toxicity.